Hello, and welcome to your Health, Wealth, and Happiness. I'm your host, Brittany Maxwell. Today we have Rosario Serrano with us to discuss Medicaid from WellCare Health Plans. WellCare's main mission is providing access to medical care services through government-sponsored managed care services. Thank you for joining us here today, Rosario.
Thank you, Brittany, for having me here today.
We're really excited to have you on the show today because our audience has been wanting to ask questions about healthcare plans on this topic for so long. So before we jump right in, could you tell us a little bit about what Medicaid is, what are some of the type of benefits, and how people can receive it while they're partnered with WellCare?
Sure. Okay, for those who do not know, Medicaid is a state federal program that is designed to help lower-income families receive medical care and assistance.
Okay.
Through WellCare's Healthy Choice Plan, eligible children and adults may take advantage of a variety of health benefits designed to get you healthy and keep you healthy. In addition to services like regular office visit, baby and child care, and maternity care, WellCare offers additional benefits such as smoking cessation counseling, free text reminders to help new moms take care of themselves and their babies for the first year, membership to Weight Watchers, and also a healthy rewards program where members can earn up to $125 in rewards for taking steps to a healthier living life.
That sounds great. I want to join Medicaid after hearing that.
Okay.
I'm sure our audience members will think that too as they want to enroll in this program. So now, who can qualify for Medicaid?
Well, any resident from the ages 0 to 64, families and children, pregnant women, the elderly, the disabled, as long as they meet the income guidelines, and it's also based on your households for New York State Medicaid.
All right, good to know. How long does it take for Medicaid to take effect then?
If you're eligible, it takes up to 24 to 48 hours as long as you meet the requirements that the state is asking for.
And we've been speaking about Medicaid this whole time alongside WellCare. Can you please give us a little bit of an explanation about what WellCare is and how it differs from Medicaid?
WellCare of New York is a provider of Medicaid managed care in New York. So the state government frequently partners with Medicaid managed care like WellCare to add value to government-sponsored programs and improve the quality of care as well as access to care. As a leader provider of Medicaid, managed care, and Medicare prescription drug plan, we embedded ourselves in the community to better serve them. And we do this by fostering strong partnerships with providers, offering an integrated care model including medical, behavior, social, and pharmaceutical operations, establishing trusting partnerships with our state and federal partners, and addressing social barriers keeping people from care in our local communities.
Well, I think that this has been an amazing and helpful service, and it's nice to know that it's available to everyone, regardless of whether or not they are a member of WellCare or Medicaid. We're going to take a break, but we will be right back. Welcome back. Earlier, we were discussing WellCare and the ways in which it is different from Medicaid. Now that we know the difference, Rosario, how much more affordable is Medicaid for those on a WellCare plan as opposed to not?
There's no cost to join. There are no charges for many services such as preventive care, flu shots, and smoking cessation programs.
That's incredible. Is Medicaid also a deductible then, or a 20% coinsurance?
WellCare's Healthy Choice Medicaid plan in New York does have some low copays, but they do not apply to preventive care or routine vision or dental care.
It's always really good to know. You need to know what type of copayments and everything you got to have on hand when you're going to these doctor's appointments.
Yes.
It's always good to make sure you have your wallet too.
Right, checkbook.
Exactly. So, are we able to find more details about this information on your website?
Yes.
All right, good to know. And what are some of the hospitals that are in the network with WellCare?
We partner with several physician hospitals and other healthcare providers in the Buffalo area. For example, WellCare is accepted at all Catholic health hospitals in Buffalo, or Erie and Niagara County, as well as Kaleida Health.
I did not know WellCare has such widespread accessibility.
Yes, again, WellCare is focused on providing our members with the right service at the right time in the most appropriate setting to help them best suit the program for them.
Of course. And accessibility is extremely important in general, but especially in cases of emergencies. Now, I understand that WellCare offers a couple different plans, some of which you've already talked about, like the Healthy Choice Plan. Can you tell us more about WellCare's Advocate Managed Long-Term Care Plan?
Well, I'm glad you asked that. It's for people who have Medicaid and need long-term care. It provides help with day-to-day activities, things like home care, personal care, which often allows our members to stay at home rather than to be moved to a care facility. Each member is assigned a care manager who will help members and their caregiver navigate through the healthcare system.
Can someone enrolled in Medicaid be reimbursed for their medical bills while they're on a WellCare plan?
Yes, any member who's eligible for Medicaid is entitled to request a retroactive coverage up to 3 months prior to the application date. If approved, for any of those months, Medicaid will pay back medical bills and or reimburse the member for services rendered during the time frame which they are covered.
This has all been very educational. I believe that from this conversation, our audience now has a better understanding about what Medicaid is, and they now know that they have the option of coverage through WellCare, who works with the government program to help access treatment and live healthier and longer lives. Finally, I'd like to take the time to thank Rosario from WellCare for coming on the show and helping answer some important questions that our viewers had. I think they were really able to clear up some of these things today for them.
Well, thank you, Brittany, for having me again, and I'm happy and glad that you're understanding the healthcare system because it could be confusing at times.
Oh, no doubt. I think it definitely cleared up a lot.
Thank you.
Stay tuned for our next episode where we will be covering Medicare with WellCare. Until next time, stay healthy, happy, and live better.